Hello, I'm Amr Mugazi. I'm a member in the Clinical Epidemiology Unit in the Faculty of Medicine, South Carolina University. I have the honor to have with me Hala Al-Wakil, Professor of Medical Parasitology in the Faculty of Medicine, Ain Shams University. Our presentation today will be about title, aim, objective, and study question, which is which. The highlights for this session will be recall the general advices, be aware with the general considerations, know the important definitions, master how to formulate the study question. Study questions answers will be included in the formulation, differentiate between aim and objectives, and finally identify the items of the title. As a class exercise, after this slide, you can just pause the streaming and write the title, the aim, the objective, and the search question of one of your researches project or your thesis, if you can remember them. If not, just imagine an idea and try to write the title, aim, objective, and search question for this idea. The general advices are for any academic work, including teaching, including projects, anything, to explore your topic extensively. So you just have the best choice of the title, the objective, and the question. In our field today, it will be a valid research, because if any of these is not a valid or not perfect, the project or the whole research will be rejected. Start from the other end. They said always don't reinvent the wheel. So how do I know for in a fast way where the other ended? Just ask the experts. Train yourself like any other thing. Training is the most important factor in success. So how to train yourself to help others? If you want to publish, just help the others who are publishing so you know what is the pros and cons. If there is a project, also help this management team or the implementation team just to know the pro and con that would assure you the most highest rate of success. Finally, we say think before you ink. This advice applies only for the final part. For the first part, when you are creating something, you have to make a brainstorming. Whatever comes to your mind, just write it. When you are coming to the final, here you have to think. Whatever is not appropriate, you can remove. But in the early phases, just write everything that crosses your mind. The general considerations are what we call the basis of the good scientific writing. So it is for a research, for a presentation, for even an article, whatever. It is avoid too many variables because this makes confusion. Avoid too many clauses because this leads to lack of objectivity. And finally, the abbreviations, when appear for the first time, the long form should be always mentioned before the short form and be informative. So just think, did this sentence or phrase added something? If not, just remove. We have actually two types of the variables, the independent variables. This independent variables is called the factor or the maneuver. It is something that is getting in our lives. It might be normal, like time passes and we have no control, or something I can control, like the maneuver, like a food. It's normal to eat, but I have here some choice or some way to avoid it or to do it. It might be abnormal, like the infection or the trauma. The dependent variable, which we call the outcome or phenomena, also it might be normal, like your puberty, like pregnancy, or abnormal, like a disease or a tumor. So this is very important because all our talk today will be about the dependent and the independent variables. So the type of work, we have what we call study and or a research. The study means we explore the nature of a variable or variables. But here, if I have more than one variable, they should be the same. So either two or more independent variables or two or more dependent variables. And the content research explores the relation between variables. So it might be dependent or independent. And as it is evident, research is part of the study. So that's why we are talking about study. The study is the general and the more global or the more enclosing body. And the research is one type of the study. So the study explore nature, and the nature here will be the research, the relation, so it is a research. The nature of the work also is important to know, either assess, measure, or evaluate. Actually, is this the right order for them? No, it should measure first, assess then, and then evaluate. So measure means to determine a variable in a defined units, like say centimeters, kilometers, pounds, inches, whatever. Assess is to judge this measure, and finally evaluate is to decide based on assessment. Sorry, there is some distortion because it is the different versions between Windows, so some letters are going down. So to give an example, if you are a basketball coach and you are just measuring the players to join the team, if you measure some player, so this candidate is 180 centimeters. If you are in an area like, for example, Korea, where the mean height of a person is about 170, so you judge this player who's 180 as tall. So you assess him as a tall player. So you evaluate, you decide he is a good candidate to your basketball team. On the contrary, if you have a player who is 180 centimeters, but you are now in, for example, Germany or Sweden, where the mean height of a person is 190, so you judge this player as short because he is less than the mean, so you decide not to take him because he's not a candidate. So sometimes the measurement doesn't mean anything much, but actually it's how you assess and how you evaluate is the important. And these are usually the plans for the research. To write a good proposal, you should define 3 things in what we call the type of research or the research design. So you have 3 items in the research design, 3 classifications are complementary. So the 3 should be present to have a full type of design. The first is according to the nature of the variable. Rather observational, where the here you call about the researcher is not mastering the variable, like someone is smoking, so I'm not controlling this variable. Someone is lifting heavy weights, so we call this an exposure. Exposure means that I, as researcher, is not mastering the variable. The other one is the interventional, and here it means that the researcher is mastering the variable, and the variable here is called intervention. It's somehow deceiving because sometimes what we think is intervention might be exposure and the contrary. For example, if there is someone addict who's injecting himself with the heroin, for example. Although this seems from our point of view as intervention, it is exposure because I, as a researcher, am not controlling how much heroin he is taking, when he is taking, and how he is taking. So it is an exposure, although it seems to be an intervention. On the contrary, if I give someone a questionnaire to fill, it is the intervention because as a researcher, I'm just controlling what is said here, what is the content, and when to give and who to give. So this is an intervention and called interventional research. In the intervention, we have 2 types, which is called experimental for animals and clinical trial for humans. According to the groups, to the grouping, we have what we call descriptive or analytical or comparative. Descriptive analytical means I have one group. This one group will be either described or analyzed. The other thing is to have more than one group. You can have 3, 4, 5, but at least 2. It's called a comparative group. Sometimes you have another entity or another specialty or another category of this comparative. It's called the controlled group. I have another group that it is control. It is the reference for me to measure for what is good, what is bad, what is high, what's low. And I have 2 types of control, what we call the negative control. So I can give someone, for example, a course and someone don't take a course and see the skill. So this is called the negative control. He's not receiving anything. Or other control was a gold standard. For example, I'm talking about tonsillitis. So the gold standard is the penicillin. So the group taking penicillin will be the control group. The group taking another antibiotics will be the study group. According to the follow-up, also we have another classification. It's called longitudinal and transverse. From the name longitudinal means there is a follow-up. So I am following between the independent variable to the dependent variable. So it might be prospective. I started from the independent to the dependent. For example, I'm watching or observing the smokers to see who of them will be catching infection or getting cancer. So from future, meaning from the independent to the dependent, and the retrospective, on the contrary, is to the past, but to translate it into items for statistics is from the dependent variable to the independent. So I get a group of smokers and get back to the history, see who is exposed to smoking, who is not exposed. The transverse is called with no time follow-up, it's called the snapshot. So I have no follow-up between the independent or the dependent variables. So for example, I don't want to know which is better for diagnosing, for example, fracture in the ankle. Is it ultrasound or X-ray? So I'm having the patient having an X-ray, then having an ultrasound and compare both. So there is no follow-up between the independent variable, which is the X-ray or the ultrasound and the diagnosis. Actually, there is no what we call time relation between them. What is objective? What's aim? Actually, objective is the thing that should be present at any work, either scientific or not scientific. Why I'm eating is have an objective for eating, for example, to satisfy my hunger, to grow up, to build my body. So any work should have an objective, and this objective should be realized to consider this work done. On the contrary, the aim is not always present. It is only present in the thesis or the research project. So for example, in publishing, I write only objective. If I'm writing here as this presentation, I'm having objectives, but I don't have an aim. So it might not be realized. The aim is the ultimate thing that might not be realized. A research question is mainly what is to be known, what I'm going to achieve, what is the gap. So this research question is usually linked to objective. I have an objective, so I have a question about this objective. And therefore, if I have multiple objectives, I can have multiple research questions. In the quantitative research, it is a closed question because they are answered by the hypothesis that will be in the next slide. But how, why, who, when, these open questions are only for the qualitative and not for the quantitative studies. Therefore, if I'm doing a qualitative study or a quantitative study, I should see whether this is valid or not. Although it is conceptually present, I have it in my mind, I'm looking for something which is a question that is not valid to be written in a form of study question, so therefore it's not valid in non-comparative studies. Why? Because to answer study questions should have hypotheses. One of them is the null hypothesis. Null hypothesis means that there is no significant regarding the variable. So I'm having a study, non-comparative, like for example, what is the death rate? So what is the null hypothesis? I can have no null hypothesis for this because this is a study and non-comparative. But if I'm saying what is the death rate, for example, in one district is more than the other district, so I have a valid study question because I can say, yes, there is a null hypothesis. The rate here is not significantly different from the rate there, which is the null hypothesis. And the alternative hypothesis, there is a significant difference regarding these variables. So there's the difference between both. In some studies, we have what we call the research or the study hypothesis. It is usually in the comparative and correlations, as the example is death rate higher in district 1 than district 2. So I have two possibilities, that district 1 is higher or district 2 is higher. And here we put it as a researcher expectation. From what I've read, what I expect 2 is to be more than 1. If it is valid, okay. It is not valid, it's also okay. So it's just a hypothesis that could be proved or could be denied. The objective of any study means the details or the steps to answer the study question. So if I'm asking a question, To reach this question, I have to make some steps. Each step of them is called objective. We have what we call a primary objective. The primary objective means that the main study variable or variables. I'm studying, for the example I've said, about, for example, what is the rate of, or is there a significant relation between smoking and lung cancer. So this is my primary objective. But sometimes there are secondary objectives. So secondary objectives are objectives that are not directly related to the study variables, but I will have them in my study. Getting back to our example, I'm studying the smokers and the relation with cancer. So I'll get a group of smokers. So I'll know who is smoking more, females or males. So I can make this as a secondary objective. So the second objective will be the smoking rate comparison between males and females. What is the most common for starting smoking? This has nothing to do with my main objective, which is the relation between smoking and cancer, but here I come at secondary objective. But just take care, because if you commit yourself to an objective, either primary or secondary, it should be realized. Or this will be considered as failure in your, or weak point in your objective or your project. So any objective, either primary or secondary, should be achieved. So objective formulation, as we have known from yesterday, it is SMART, which is specific, measurable, attainable, realistic, and time-bound. But actually here, it is not so smart, because in the research concerning, in the project concerning research, we have other like methodology and these things. So I can say, for example, as an objective to measure the level of glucose in the serum of the patient. I did not mention it as, for example, timely, because this will be mentioned in the methodology that I, for example, be taking the samples 2 hours, 8 hours, for example, 12 hours after meals. So here it is not so smart as in the other projects, but if I can do it, it's better. But here it's not very strict as the others. The title is very important, because the title is the first thing that you would fit the reviewer. If it is good, it gives good impression. Bad gives bad impression. So title formulation, we're talking about what we call a formal title. So it reflects the plan of the study. So it is related to the objective and complementary. So they're talking about what to do, and here is mainly how to do it. So this is the main philosophy of the title, is how to do it. It should be concise, as you say, conceptually straightforward. So you should avoid unnecessary wording. So for example, I cannot say in cases of patients of, I can say in patients of. So as much as I can reduce it, be good, because sometimes you have limitation for the wordings. We should also avoid oversimplicity, because it is non-professional and misobjectivity. For example, say anemia. What is anemia? Is it iron deficiency anemia? Is it bone marrow aplastic anemia? Is it primary anemia, secondary anemia, microcytic, macrocytic? So it is. This is called oversimplicity. I'm talking about hernia. What's hernia? Is it inguinal? Is it direct? Is it indirect? Is it reducible? Is it complicated? So I should, as much as possible, avoid this oversimplicity. The items, it's very important in the thesis and the project, but like I have in here in my presentation, it told which is not obeying anything or any format. But in presentations or publications, we might not be committed to this. But if you are a research project or a thesis, this should be strictly followed. First word, usually the methodology. What I'm going to do: evaluation, correlation, determination. These things is usually because this defines the general plan of the research. Secondly, what we call the independent variable, which is the intervention of the observation in its most specific form. So just search what is the most specific form, followed by the dependent variable, which might be a target or the target population, like a male, female, children, adults, etc. Location, sometimes the geographical location. If I say, for example, death rate, where? Is it in a country? Is it in a continent? Is it in a village, in a hospital? So location is important. Also, it might be a location like anatomical. So I might be seen in upper limb, in lower limb, back, and whatever. Sometimes other words are important to complete the good meaning or to achieve the good meaning. For example, a multi-center study, for example, prognostic study. So this might be used to just to clarify more the what we say my plan of work. Here we're having a class exercise. This is an example one. This is supposed to be a title, and you should write this title, read it, and pause to one, criticize this according to the what we said before, the items we said about the scientific writing and the items of the title, and then try to suggest another title, another aim, another objective, and a study question. This is example one. This is example two. This is example three. So go to example one. Avoid too many variables, avoid too many clauses, conceptually straightforward. Did this title avoid too many variables? No. Too many clauses? No. Conceptually straightforward? No. For the formulation, the methodology should be mentioned, the target population should be mentioned, the location should be mentioned. No methodology, no target population, and no location. So this is a bad title. Actually, there is nothing right and wrong because we did not understand what this candidate wants to do, but we have suggestions. Evaluation of the effect of intravenous iron sucrose on cardiac function and metabolism in adult anemic patient in Egypt. Actually, this should not be your title, but it should have, as we said, the methodology, the variables, the target population, and the location, and others if possible. This is the aim, as that should be something visionary, something ultimate goal, which is to improve the quality of life of patients under treatment of anemia. The objective as such should be smart, to assess the cardiac metabolism in cardiac patient receiving IV iron, and the research question be, is IV iron sucrose level significantly affects, or does IV iron sucrose level significantly affect cardiac function in anemic patients? It should not be like that, but it should have the same essence of the same formulation like this. Number two, reflects the main objective, avoid oversimplicity and informative, because quality of trauma registries are very simple. Does it reflect the main objective? What I'm going to do, avoid oversimplicity and informative. Also the methodology, target population and location. Methodology was not mentioned, target population was not mentioned, location was not also mentioned, so it is a bad title. As suggestions, we can say correlation between the registry of trauma used and the patient outcome in primary hospital. Here we had what we call better understanding, specification of the variables. Cannot change the quality of trauma care because this is very broad, but here I had one parameter, which is the patient outcome. Did he die? Did or she died? Did the patient survive? And here we can between registry of trauma used. So does this registry better than this one regarding the outpatient? And here at the place is the primary hospital. Here the aim is to enhance the outcome of trauma patients. The objective is correlate different registries to the outcome of trauma patients. And the third question will be, is there a significant difference between registry, for example, 1 and registry 2 regarding outcome of trauma? We have here the hypothesis valid. Of course, as I said before, this should not be yours, but it should be within the same formulation. The third one reflects the main objective, avoid abbreviations and informative. So it does not reflect the main objective. I don't know what he's going to study or to know. Abbreviations, we have two abbreviations, which is the IVC, CT, and the symbol N, which is informal, should be written in the title or in any of the important titles in the thesis, and also not informative. I didn't know what he's going to do. The methodology, target population and location. The methodology was not mentioned, the target population was mentioned, but take care, the location here was mentioned. The location here is mentioned as anatomical. It is the IVC and iliac veins. So the location is mentioned here. Still, it is a bad title. It is 1 and 5 are wrong. So because of the limitation of space, so the title will be Evaluation of Multi-Detector Compute Tomography Rating in Full Accuracy in Detecting Congenital Anomalies of Inferior Vena Cava and Iliac Veins in Neonatal Lower Limb Edema. Actually, I had no space to write the aim, so I'll just say it verbally. It can be improve the quality of diagnosis of causes of neonatal lower limb edema, is to give better, more accurate diagnosis of causes of neonatal lower limb edema, more rapid or faster diagnosis of causes of neonatal lower limb edema, and so forth. Here the objective could be compare the specificity and sensitivity of multi-detector CT in detecting congenital anomalies of IVC and iliac veins in neonatal lower limb edema. Of course, I can have this as two separate objectives. For example, objective 1 is to assess the sensitivity of multi-detector CT in iliac veins, and objective 2 is to assess sensitivity of multi-detector CT in IVC, and the third will be compare them to each other. And the third question will be, is multi-detector CT more specific or sensitive in detecting congenital anomalies of IVC than in iliac veins in neonatal lower limb? Sorry again for the for this problem in the format due to change of the versions. Another classic exercise, which is simpler here, it is about aim or objective. What do you see here? Is this an aim or objective? You can just pause for 1 minute and see if you want time. Actually, as we said, objectives should be specific, should be measurable and attainable. What they will better understanding. What I mean by the rule. These are things that could not be readily understood or achieved. So this is an aim. On the contrary, you can assess function of a mediator in the fact this is very specific. This can be reached and attained. So this is an objective. Is that a valid or not study question? Do mediators significantly change the inflammatory process? Actually, like in law, we are in research methodology. We don't like the words that they cannot catch. What do I mean change? And actually, is it the mediator that changes the process or the process changes the mediator? So this is not a valid study question. The study question, valid one is, do mediator levels significantly correlates with the inflammatory process? This is a valid question because it will be null hypothesis, they're not significantly correlate, or the alternative hypothesis significantly correlate, and can have also here the research or study hypothesis can be positive correlation or negative correlation. What type of hypothesis is this? Mediator level doesn't significantly correlate with inflammatory process. If there is a negation, it is usually the null hypothesis. If it is no negation, like mediator level significantly correlates with, so this is alternative hypothesis. Can you say here, or can you suggest here, a research or study hypothesis? Yes, we can say that mediators level significantly or negatively significantly correlates or positively significantly correlates. To appraise what we call the title, the objectives, the aim, and the study question, I should have requirements. What are these requirements? You can just pause here and write a brainstorming, see what are these requirements. First of all, to know the work. Is it a thesis? Is it a research project? Or is it an article? Or of course a presentation, but this is not valid for that one. Subjects and patients to determine what's the type of the study, and the study population to know the inclusion and exclusion criteria. This is actually, I said others. So for example, if I'm doing a research about the diabetic patient and I'm excluding the hypertensive patients. So the exclusion is hypertensive. So the title should contain study in diabetic non-hypertensive patients, and that fall in the category of others, because it's very important to know in the title. Location, of course, as we said, is anatomical or geographical whenever it is important. The methodology chapter, we have the design, the type of the study, and the variables. There's a chapter called the statistical analysis to know the type of work and the type of the study. Thank you very much.